Hello radiographers, hope you are doing good. So let's start HRCT of temporal bone. For this patient position is head first supine and position such like that the coronal laser light goes through the external auditory meatus and the median sagittal light over the midline of the face. And now go to the console and register the patient and select from the head the inner ear and select head first supine position. And now at first the topogram scan will be start. And click the load button to start the topogram and again load and wait for some time. And now press the start button on the control box. Here is the skull lateral image, and on this topogram plan the temporal bone planning and drag the field of view over the ear and drag the upper line and lower line to cover the whole temporal bone including the mastoid, and also drag the anterior and posterior line so that the whole temporal bone is inside the field of view. So after adjusting, click the load button and press move and then press start, and the fast scan will start. And now the software will reconstruct automatically 4 times. You can see there is 4 box in the inner ear section. The first reconstruction is on the both side and the second reconstruction is going on. I am checking the first reconstruction. And now the third reconstruction is running. I am waiting for the reconstruction to be completed. Then I will go to filming. So this is the left side. This is left ear that is reconstructed into window, inner ear window, and kernel is HR60, and the slice thickness is 0.6 millimeter of each slice that is reconstructed. So this HRCT means high resolution computed tomography. So to get high resolution images, so we have to reconstruct the images in thin slices like 0.6 millimeter or 1 millimeter. In high resolution HRCT temporal bone, the temporal parts are visible in high resolution like vestibulocochlear and the mastoid parts. Now go to patient browser and from the patient folder, so at first select the inner ear 0.6 HR, that is the both ear, and take it to the 3D application. And first on the coronal image drag the reference line and angle the reference line so that the temporal bone is visible on the both sides. And on the coronal image plan the axial slices and drag the slices to cover the temporal bones. And align the slices so that the slices are parallel to the temporal bone, especially the vestibulocochlear. Vestibulocochlear should be visible on the both sides in a slice. So I will select 23 slice here and click start. Here is the axial slices on the both ear. I will make it again because I think the images are not parallel on both sides, so I will angle the slice a little more so that the vestibulocochlear is visible on both sides in a same slice. So I will dragging the slice to adjust the image so that both side is parallel in the image that I am making, and click start and check the image. And for this the thickness is 0.6 millimeter, and I have made 23 images, and I send it to the filming and also send the reference image. Now I am in the filming. First in the filming, change the layout to 4:6 so that 24 images is fit in the film. And now drag and adjust the size of the image by using the zoom pen option. And you can also change the contrast of the image a little bit. Not try so hard to change the contrast. So this one is the first film that I make for HRCT temporal bone, and this film shows the both side temporal bone of both side. Now go to patient folder again, and from patient browser select the third protocol, that is right inner ear. Select right inner ear and take it to the 3D application, and this is the only right side of this is the right ear, and here I am making the axial images for right ear, and for this I am planning on the coronal image, and the thickness remains 0.6 and the number of image I will change to 23. And now drag the upper slice at the top of the mastoid part so that the whole mastoid portion is covered, and I will drag the bottom line to the almost near to the TM joint, and click start and save and send it to the I will save as I will give a comment on this series as right ear, and it will appear on the comment below of the each image, and then save and send it to the filming. And also I will send this reference image with slices, and then in the filming I will change the layout to 4:6 and adjust the size of the image and also the reference image. So this is the second film of the HRCT temporal bone, that is only right ear axial view. And give patient informations in all the segments and then print out. And I will close it from the 3D app. Sorry, I will make sagittal images from this for right ear, and I am selecting the coronal image to make the sagittal images. So I will change the slice orientation to sagittal and drag the slices so that it covers from the external auditory meters to the vestibulocochlear part. So drag the slice and look where the slice is on, and then click start. So this is the sagittal images for right ear, and save as right ear, and this text will appear as a comment on the film so that radiologists and doctors can understand that which ear this is. And now in filming, change the layout to 30 as I make 29 sagittal images and one reference image, so 30 images will fit in the film. And now adjust the reference image and also the sagittal images and enlarge the size of the image so that it looks more closer. Will make coronal oblique images for this right ear. You can see that I am changing the number of images to 29, and on the axial plane I am angling the slice so that the vestibulocochlear and also the mastoid part is visible in the same orientation. So for right ear, angle the slices like that, and it's a coronal oblique. You can angle the slices parallel to the auditory canal or the mastoid bone. You can take it as a reference for the angle and then click start and save as and give comment right ear, and then save and send it to the filming, and also this reference image send it. And now go to filming, and in the filming change the film layout to 5:6 so that 30 images fit in the film. And now adjust the image and also the reference image. So this is the fourth film, and it is a coronal oblique film of the right ear. And now print out. So my right ear job has been done, and now I will work for the left ear. Now go to the left ear and select the protocol and take it to the 3D application, and like the right one I will do the same job in for left one. So at first I will make the transverse images for left ear, and for this I will select coronal image, and over the coronal image I will plan the axial slices. So I will select the parallel ranges, and I will reduce the number of slices to I think 23. So I select 29. Oh, sorry, I again change it to the 23, and I'm fixing the number so that when I drag the slice number will not increase or decrease. So drag the upper slice and lower slice so that the whole temporal ball is included, and then send it to the film. Sorry, I will save as. I will click save as to comment the left ear. So I will type left ear in the comment box and also in the range series name, and then click OK, so that the left ear is commented below the each image. And now send it to the filming and also the reference image. Now I am in the filming and changing the layout to 4:6 so that 24 images fit in the film. Among them 23 is left ear axial image and 1 is reference image of the slices. And print out. Now make the sagittal images for left ear. For this again plan on the coronal image, but this time the slice orientation is changed to sagittal, and then change the number of images to 29 and distance between images is 1, and drag the last slice to the lateral side of the ear and include all the temporal bone portion from inside to outside, and click start. So 29 images have been created, and now send it to the filming. Sorry, I forget to save as comment. Give comment. I will comment left ear, and also the range series name will be left ear, and then OK, and then I will send to the filming and also the reference image. And in the filming I will change the layout to 5:6 so that 30 images fit in the film, and 29 sagittal images I am adjusting the size of the image, enlarging the image, and make sure that the bony part didn't cut out, and also adjust the reference image. So this is the second film for the left ear. This one is sagittal, and then print out. And now I will make coronal oblique image for left ear. For this I will plan on the axial image, and from the parallel ranges I will select 29 slices, and the image thickness is 0.6 millimeter and the distance between image is 1, and I will angle the slices parallel to the mastoid part of the temporal bone. So keep the middle slice over the vestibulocochlear part. There is the cochlea and semicircular canal visible. So dragging the slices, I am viewing the images so that it covers the whole temporal bone at the front and back. So this is a good angle to visualize the vestibulocochlear, semicircular canal, tympanic membrane, and also the mastoid part of the temporal bone. So 29 images will be created in this angle, and this is the coronal oblique. I am taking time for making this, and click start and check the images, and now save as, again left ear, and also give the series name to left ear, and then click OK, and then save and send it to the filming, and also this reference image, send it and go to filming, and in the filming change the layout to 5:6 so that 30 images fit in the film, and among them 29 coronal oblique image and 1 is reference image. So adjust these images to look it better. And after adjusting and fine-tuning, you can print out this film and give patient information to the segments. This was the HRCT temporal bone. So thanks for watching. If you like this video, please hit the like button and don't forget to subscribe my YouTube channel, and thank you again, and also hit the bell icon.